Hi, I'm Dr. Jason Tripp. We've been talking about lower back pain, sciatic pain, and even bulging and herniated discs. And one of the things we talked about was that getting that bulge or that herniation corrected using non-surgical decompression is huge. However, today I want to talk to you a little bit about nutrition and the role that nutrition plays in healing your back or healing a neck pain, some kind of body pain like that. In other words, getting your body better using nutrition, and how does that work? So there's actually 5 different factors that you can use to get your body better when it comes to nutrition. Today we're going to talk specifically about the food allergy or food sensitivities is more likely. So if you had a food allergy, if you ate peanuts or ate a piece of lobster or something like that, your face would swell up. It would be a bad situation, and you knew that immediately. Like as soon as you eat it, you find out. But if it's a food sensitivity, it could take 2 or 3 days, a week, or a month before you actually knew that anything was wrong. And you're not going to put 2 and 2 together a month later. Hey, I think I ate a piece of watermelon or pie or whatever it is you're sensitive to. And so I want to give you my background a little bit. I had 7 herniated discs. I was in pain all the time. I could barely stand even to adjust my patience. Like it was a hard place to be. And long story short, I was looking for answers. I found out about spinal decompression, started working on doing it, but I still had lots of inflammation and my body was in pain kind of all over. I had joint pain. I had pain in the arms and the shoulders and in the legs, the hips, and even in my back and what have you. So I was going through the healing process. I decided to go ahead and take the extra step and check and see if I had any food sensitivities, food allergies. I found out I did. I had 72 food sensitivities. Wow, that's a lot. Almost everything I ate I was sensitive to. I had to stop and change my eating habits. Let me tell you, though, it was worth it. I would do it again today. If I had found out I had 72 food allergies again, I would stop eating and go back to a good diet, and I'll tell you why. It's hard to change, but the reason I did it is that food allergy, that food sensitivity in my case, caused inflammation in my body that allowed my whole body to hurt. And when I stopped eating the foods that I was sensitive to, the pain level, the inflammation level came down and my body didn't hurt. So if you've got chronic pain, even fibromyalgia, or if you've just got a bulge or a herniated disc and you're trying to bring down the inflammation, one great test is to find out, do you have any food sensitivities? Yes, it'll help you with your pain. It'll also help with digestion. It'll help with weight loss. It'll help with energy level. It'll help with hormone balance. It'll help with skin and how you look and all of that. It helps with an amazing number of things. I could go on and on and on with the list. But the reality is it helps your whole body to heal better. And so if you're suffering with a bulge or herniation, that's the topic we've been on, a good chance that you could have a food sensitivity because so many people have it. Right now, we suspect that around 60% of Americans will have some type of food sensitivity, maybe even higher. And so a lot of people just haven't been tested. I didn't get tested for years, thought I was okay. I was having all these weird symptoms, but didn't put that together. So I'm going to suggest get your food allergy test or food sensitivity. I keep saying that wrong. Food sensitivity test. And once you do the food sensitivity test, you can see if you have inflammation from the food you're eating, which could be causing your problem. How easy is it to change your foods? Absolutely not hard at all. The only thing is emotions. It's hard to change emotionally, but you can absolutely change your eating habits. And if that was the cause of your pain, would you be willing to give it up? So I want to encourage you to get checked out, find out if you can be helped. If you're not beyond that 85% damage we've been talking about in previous videos, go back and watch them if you haven't. But if you have over 85% damage, there's likely not a lot that natural things or natural medicine from naturopathic or chiropractic methods is going to do. But if you're less than 85%, then more than likely you're just going to get great results. You're going to do well. And we may have to look at food sensitivities or other things, but you're going to do well and get better. So I'm going to encourage you to get down, call the office, ask for your back pain checkup, and we'll give you a checkup where we'll check all 9 of the factors that affect neuromusculoskeletal injuries. In other words, all the 9 factors that affect the lower back. And so we'll go through the test. I'll tell you what's wrong, what we can do to help, how long it'll take, all of that. We'll go over everything. So call the office today, 724-342-2225, or check out the website at drjasontripp.com. I'm looking forward to seeing you.